Hello class, my name is Louis and my topic for discussion will be non-coercive paraphilias. The first thing to ask is what is a paraphilia? According to the Diagnostic and Statistical Manual for Mental Disorders, our text defines a paraphilia as a mental disorder characterized by regular, intense, arousing fantasies, sexual urges, or behaviors which last at least 6 months. They also involve the interaction of non-human objects, the suffering and humiliation of oneself or one's partner, and lastly, children or other non-consenting adults. The specific non-coercive paraphilias that will be mentioned are fetishism, partialism, transvestism, and lastly, sadism and masochism. The first of the non-coercive paraphilias is fetishism, which is a sexual attraction to objects that for a person become sexual symbols where the fetish is usually required for sexual arousal. If the fetish is not available, it can even lead to erectile problems, and where a person can normally relate to another human being, a person with the fetish relate to inanimate objects for sexual pleasure. Sometimes these objects may be things like shoes, clothing, lingerie. A fetish that is an exclusive attraction to body parts is called partialism. A person may be sexually attracted to specific body parts of a woman, such as ears, feet, breast, legs, or other parts of the body, whereas many women are attracted to men's buttocks and abs.
For real? Also, can I have a pair of your gym socks? And don't worry, it's not for anything weird. It's just a fetish I have.
Like my friend John Ralphio, most people in fact display minor fetishistic behaviors, and for the most part, this non-coercive paraphilia does not cause any harm, and most people tend to display their behavior in private with the partner. Transvestism is another non-coercive paraphilia, which is wearing the clothing of the opposite sex for any reason, and sometimes even for sexual arousal. From studies, it has been seen that cross-dressing is something that is done mostly by males, both heterosexual and homosexual. According to some statistics from our text, a survey found that out of 1,000 cross-dressing males, 87% were heterosexual, 60% were married, and 60% of this study group reported that sexual arousal or orgasm occurred while cross-dressing. Cross-dressing isn't always necessarily a paraphilia. Sometimes it is done for humor and parody, but for other cases, people may be considered to be psychologically disordered. People with transvestic fetishism have reoccurring sexual urges and dreams wearing women's clothing and are normally heterosexual men. It is something that usually begins prior to adulthood, where men report childhood experiences of being humiliated or punished by being forced to wear women's clothing. A lot of people with transvestism marry and have a family in hopes of curing their desire to cross-dress. Some end up telling their spouse. Many women do not necessarily approve, but just deal with the fact that their husband is a cross-dresser, and a lot of times this may cause stress and sometimes it can lead to the couple separating. It is usually seen as harmless and requires treatment only when it is not controllable and it causes distress in that person's life. And sometimes many people may seek counseling to deal with feeling guilty or shame. The next non-coercive paraphilia is sexual sadism. A person diagnosed with sexual sadism, like previous paraphilias, is characterized by a period that lasts for over 6 months, but in this case the person experiences urges involving behaviors in which there is physical and or psychological harm done to another person for sexual arousal. The symptoms for this disorder include violent sexual thoughts and fantasies that involve a desire for power and control which focuses on the victim's physical suffering. Although sadism in this case is being looked at as a non-coercive paraphilia, it does have the potential to be a serious offense where the victim may be tortured, raped, and even killed. In the case of a person consenting, it is known as sexual masochism. The last non-coercive paraphilia is sexual masochism, and just like sadist, sexual masochism involves the same diagnosis, but instead of causing pain to another person, they have urges and behaviors of wanting to be humiliated, beaten, or suffer. This act does not have to take place with another person, as some people cause themselves harm by self-mutilation. Some behaviors associated with masochists and their partner may involve being restrained, blindfolded, whipped, beaten, and many other acts of being humiliated. For some people, the degree of pain and humiliation may be a lot greater to achieve sexual arousal.
Do I have your consent to play with you?
Ah! Yes.
It's not terrible.
Can I do it harder?
Yeah.
Do you want it harder?
Eugene.
Oh, sorry.
So I'm getting spanked now.
So how do people develop these kind of mental disorders? There's actually a very small amount of research that is available to determine the actual cause as to why people develop paraphilias. It is most likely from any kind of interaction with biology, social-cultural norms, and life experiences. Therapists have found it quite difficult to treat paraphilias, and those that are treated are generally sex offenders. There are complex treatments such as psychodynamic therapy, aversive conditioning, cognitive behavior programs, and medical intervention.
That's all, folks.
I'm tired or if I'm stressed out, then I'll start to just play with my ears. And next thing you know, my ear will be folded inside of my head.
That's horrifying. You just pushed your ear into the.
Am I slightly less attractive now?
No, that made no difference at all.
Like I wander around film sets and I'm always checking out people's earlobes to see if they've got good ones.
Yeah, well, really get in there. Get in there. That's nice.
How about? Oh my God!
What? Why him?
Oh my God!
Why
They're so juicy and big. You have fantastic lobes.
Thank you. Told you, Conan.
Mine gets bigger if you just keep.